Hey everybody, I'm Dr. Orlando. I'm here with Vive Health, and today we're going to be doing some things for back pain. Okay, so if you're experiencing anything like acute back pain, maybe you were leaning down and then you started to feel like you got a little tweak back there, or if you have issues that have been chronic and long-standing and you feel like you're stiff throughout the day, these are great mobility exercises to kind of tackle those issues. As always, before you exercise, check with your doctor, make sure that they feel like it's a good thing that is going to be conducive for you, and make sure that you just feel like you're going to be comfortable and confident. And if not, you're always work with a professional. So first things first, we're going to go down to the floor. We're going to be doing some things that are almost like modified yoga poses. So if you're a yoga enthusiast, don't try to blast me too much on this. So we'll come down to the floor and we'll try to get to all fours. Make sure that you have something a little bit cushiony under you. I normally don't recommend people go to the hardwood floor or anything like that. So just make sure that you have maybe a yoga mat or something like that. We're gonna start with something called a hand heel rock. It's also kind of a child's pose to cobra, some people call it. So you'll start on all fours, and then you're just gonna reach your bum back toward your heels, and then you're gonna tuck your head. The goal is to try to open this low back the best that we can. So we're trying to flex it and allow it to move. We feel a little stretch there. I even feel a small stretch right there, even though I'm not fully back. We'll hang out there just for a breath or two, and even on the exhale, you try to sink into that a little bit more. And then as you come forward, you can move your hands wherever they feel comfortable, whether they're out, whether they're forward, but we're gonna try to get the pelvis down toward that surface, okay? So some people, they can arch way back there. I don't like that for my own self, but for you, you just go to wherever variation you need to. If you can go down to the elbows and have a little bit less arch, even if it's way down here, that's still good. We'll hang out there for, again, maybe a breath or two. And then we'll sink back to the heels, kind of in that child's pose. And then we're moving forward again, trying to get those hips down to the mat, okay? Once we get finished with that, the next thing I really like people to do is what's called a cat-cow. So you're back on all fours, and then you're trying to arch like a cat, and then really tuck that pelvis down and in. Head is tucked down, and then you're reverse arching like that cow. And again, you're trying to round that pelvis a little bit. This helps with a little bit of flexion in the spine or bending forward, and this helps with a little bit of extension or bending backwards. Okay, we'll do a few reps of that. You kind of just go with your breath. We're not holding too long, 3 to 5 seconds, maybe just going back and forth about 10 times. I normally like 10 reps in between each. That seems to be good just for about everybody, and I can only really count to 10 before I get my shoes off, so it's helpful. The next thing I like people to do is to have a foam roller with them. This helps with the mid back. So right in between our low back and where we're getting to our mid back, we start to do things like rotate. So for the thoracic spine, we really like to rotate. This helps with this. If we're already in that all fours position, we get a foam roller, and then we are doing an exercise called thread the needle. So we're going through the arm, we're gonna reach across as far as we can, and again, maybe on an inhale, exhale, and you're further reaching. And I'm trying to reach for the closest cookie jar that I can, and I'm going as quick as I can. And then I'm gonna do the opposite side. So normally I do about 5 reps each side, and I'm rotating through. And again, to the point where I feel like I'm stretching, but I'm not forcing, right? Any stretch, any mobility exercise is really, really good until we start to force our body to really go through it. Then our body starts to fight a little bit and can be non-productive or destructive for us, and our body starts to fight against that movement. So just going until we feel that. I mean, if it's discomfort and you're already in acute pain, it's okay to feel 1, 2, or 3 out of 10 pain where you feel some things, because normally it means that you're trying to work into a certain range. But if you're starting to feel like, man, this is getting achy, but Dr. Orlando told me to do this, that's too much, okay? And that's where it's nice to work with a professional and work with people like Vive Health, because they can just help you, guide you toward the direction you need to be going with those things. One of the bigger mobility exercises, now that we can get maybe off the floor a little bit better, our spine is moving well, I really love an inchworm exercise. So an inchworm exercise, now that we've bent a couple times with the spine going forward and backward, we're gonna reach down toward those toes, and we're gonna try to get those piggies the best that we can. And if you're really flexible, maybe you get all the way down there with having your knees locked out. If not, we can have a soft bend in the knee. That's all good too. Sometimes I need that to tie my shoes. And then we're gonna walk the hands out, and then we're gonna try to settle the hips down and lay fully down. Okay, we're gonna go back up into that cobra pose that we already practiced, and then we're gonna bring the knees off, and then we're gonna walk our hands back. So real-time speed, that's probably about it. We're not going much faster. Reach for those piggies, little bend in the knee if you need it. Walk the hands out nice and slow. Hips down on the ground. Roll, chest up, and walking it back. Okay, I love these exercises for people that want to get their spine more mobile, and maybe they're getting ready to exercise or go on a walk with their dog and they're just a little stiff. It's perfect for just about everybody, and it gets kind of this whole section, even from the mid spine all the way down to the lower spine and the pelvis, but it gets us nice and mobile and very minimal equipment. Maybe we use a foam roller, maybe we need a yoga mat, something super, super simple. But if you're looking to get your spine a little healthier, a little more mobile, and out of this chronic or acute back pain, perfect exercises for you.